I seen a meme. I think it's a fibro meme therapy, but they repost other people's memes and they credit. So I'm not giving them shit about it. It said doctors warn ibuprofen can blow out your stomach, but won't prescribe painkillers. That's so fucking true. Oh my god, it's so obnoxious. There are some, I mean, everyone watching us gonna go, duh. But there are some really fucked up issues in the medical system in the US. And I mean, even beyond just the fact that it's for pay, like prostitution. Like, okay, for one, that is 100% correct. I mean, if you gave me one Vicodin, I'd probably be okay. Now, do I need managed to make sure I don't get addicted? Yes. Do you know why they won't do that outside of they're afraid of lawsuits? Because they don't have time for shit. Because they're for pay, like prostitutes. I have had more than one doctor lie to me about how a medicine is used. And so I frankly just don't even trust them anymore. Like they used when I was given prednisone at the free clinic because no Obamacare yet, they said don't get pregnant and don't drink. If you know prednisone, you know it needs a lot more warnings than that. I started insisting I got the little pamphlets with them because at the time I wasn't even getting the warning pamphlets. Then, for instance, another one that shows it's cultural sometimes is like Inbrel. Last I knew, it may have changed since, but Inbrel said you can drink like once a month in the United States. In Europe, it's once a week. There's a pretty drastic difference. So, like, I just don't trust anything they say. And I know the way I see doctors anymore is I have to go to you legally to give me medicine and you only put up with me so you get paid. You don't really give a damn about me or anything. So this is extremely transactional, like hookering, but we both have to play the game just so it stays on this side of legal. It's very fucking annoying. That's why with my hip issue that I need the cane for that I bought from Daiso, which was a dollar store, um, haven't even considered going in because one, it'll take a year to see my room. And two, I'll say, I just don't know. Before my hip went out this badly, I went in 3 times. I somehow managed to go in. It was quite the fight. 2-hour drive. Nothing. No help whatsoever. I want to give you an opioid story. I've only truly been on opioids once before they realized, oh shit, we shouldn't be handing these out like candy. I wasn't sick yet, but, well, sick like I am now, but I had that massive cyst tearing my ovary open and was bleeding internally, so they gave me Vicodin. I was flying. They also gave the really lovely advice that this is 2008, Van Nuys, fuck you, Van Nuys. They said, well, you have to leave the waiting room, and we can't keep you back here, there's no room, but you shouldn't drive for 3 hours. Okay, bye. Mind you, I drove there. And I'd literally just moved like 3 months before, so the few people I knew didn't have cars. I don't even know if they could drive. Most of them couldn't, from what I did know. So I flew down the 405, was it, to get home. And they gave me some, that was liquid Vicodin. They gave me some Vicodin to go, which of course I instantly mixed with booze because they didn't tell me not to. And that leads to the story of losing my virginity in, well, not in, but associated by a red Mustang driven by a Reagan, but no, I didn't lose it to a Reagan. This is a true story, but anyways. Um, so like, okay. So after that, I just stopped believing, doctors have anything in my best interest at heart. And based on what happened later, they don't. But um one story that I think really encapsulates how fucking stupid and useless the US is right now. I've been on Tramadol, which is technically an opioid, but it's very, very low addiction risk. For like, I don't know, let's say 10 years now. About around COVID, I get a little questionnaire and a nice little letter from the University of Iowa, where my room is. And it says, could you go off the Tramadol? We don't want our patients on opioids anymore. Did they offer any other solution? No. And judging by, especially with my hip right now, I'd be super fucked with that Tramadol. So anyways, I wrote them back and I said, well, okay, you give me Vicodin. I will go off the Tramadol. They fucking had a panic attack based on the way they wrote me back. I mean, oh my god, it was hilarious. And they tried one more, or no, they tried once before and I ignored them. And then they tried that time and they never tried again. I will not suffer fools. You will not take my medicine unless you give me proof it's killing me and killing me more than my illnesses. Because I get that with the ibuprofen too. I was put on 3 800 milligram pills before they decided no, it should be 2. And I tried the 2 and it did not work good. And so now I get all those warnings, but I don't know why it was safe in 2010. I mean, to be perfectly honest, I just assume someday one or the other is going to kill me. So I'd rather it be the medicine because I feel like that'll be more quick, less pain. I would love some real opioids, not because I'm bagging or shopping. If I wanted to just go get opioids and get fentanyl fucked up, I live next to Olwine. Olwine is the meth capital of the world, and guess what took over meth? Fentanyl. If I wanted to just go be a opioid whore, I could easily do it. I don't want to be an opioid whore. I don't want to buy opioid off the streets. I want something actually prescribed by a doctor and put through a pharmacy and monitored if need be. I mean, the whole point for me personally is if I'm going to keep living, I need to be in less pain. They don't give a shit. They're like, I mean, it looks bad legally. We don't really care about you. We only got 15 minutes for you, but it looks bad legally, you see, hon. Fuck 'em.